Goodpasture syndrome. What is it? Goodpasture syndrome, also known as systemic capillaritis with a predominant lesion of the lung alveoli in the basal membranes of the glomerular apparatus of the kidneys, is a rare immunological disease characterized by inflammation and damage to the vascular walls in the lungs and kidneys. The exact causes of Goodpasture syndrome are still unknown. However, it is believed that the immune system plays an important role in the development of this disease. It is possible that autoimmune processes or impaired immune regulation lead to inflammation and damage of the vascular walls. Predisposing factors that may contribute to the development of Goodpasture syndrome include genetic predisposition, infections, such as hepatitis viruses, HIV, certain medications, cancer, and other systemic diseases. The main clinical manifestations of Goodpasture syndrome may include hemorrhagic pneumonitis, coughing up blood, coughing with blood, difficulty breathing, glomerulonephritis, appearance of protein and blood in the urine, swelling, elevated blood pressure, and general symptoms such as fatigue, weakness, and loss of appetite. The diagnosis of Goodpasture syndrome includes a clinical examination, urine and blood tests, chest X-ray, computed tomography, and biopsy of the lung or kidney. Determining the level of anti-nuclear antibodies and other immunological markers may also be helpful in establishing the diagnosis. The main principles of treating Goodpasture syndrome include immunosuppressive therapy aimed at reducing the activity of the immune system and decreasing inflammation. Corticosteroids and cyclophosphamide are commonly used medications in the treatment of this syndrome. In some cases, kidney or lung transplantation may be necessary. The prognosis of the disease can vary depending on the extent of organ damage and the effectiveness of treatment. With timely and adequate treatment, most patients have a good prognosis. However, in some patients, the disease may progress and lead to chronic kidney failure or the development of pulmonary fibrosis. Currently, there is active research into new treatment methods for Goodpasture syndrome. Some of the promising approaches include the use of biological agents, such as rituximab, as well as inhibitors of immune cells, such as cytokine blockers. However, these methods are still in the research phase and are not widely available in clinical practice. Timely diagnosis of Goodpasture syndrome is important as it allows for the initiation of treatment and prevention of disease progression. Early consultation with a doctor upon the onset of symptoms such as hemoptysis, changes in urine, or general symptoms can be crucial for successful management of this condition and improving the prognosis.